Well, good morning, everyone. Thanks so much for joining us for our advocacy update here in the month of March. We really appreciate you joining us. We will have some time after the presentation to answer questions, so please use the Q&A feature on the Zoom app. And we are joined today by OSPF CEO Tony Coder and OSPF's Chief Strategy Officer Daniel Bennett. And I believe that Tony, you're going to get us started today.
All right, thank you so much. Yeah, if you have questions, please put them in the little chat feature thing over there, and let's get started here. So, some federal legislation updates. Daniel and I have been working with some federal folks and got an update on COPPA 2.0, which is the Children and Teens Online Privacy Protection Act. This is an act that was actually created back in 1998 and has not been updated since to protect the anonymity and the privacy of kids. It did pass the Senate unanimously. I know that Daniel and I have had conversations with a congressman from Michigan that wants to take this over to the House and do a companion bill. It does strengthen the privacy setting for teens online, which is what we are really interested in, especially as more and more folks, more and more kids seem to be I guess, commingling with adults and getting in trouble. Also, allowing parents to know what their kids are doing a little bit more. Um, it bans the online platforms from collecting personal information for teens ages 13 to 16 and can create an interesting eraser button for parents for youth accounts, which I don't know exactly how they're going to make that work. Daniel, I don't know if you have uh, any updates on that.
Just kind of from what I read, and I will preface by saying I'm not a lawyer, so looking at the language sometimes is a little dicey. But it would basically create an option where if parents decided that their youth should no longer have that social media account, they would be able to just choose to erase it. It's completely gone. I know some family and friends that have taken a break from platforms like Facebook in the past, and if you look their name up, it'll just say that this person's not active. But if they choose to, they can come back and put their email in and it'll reinstate their account from where it was at. I believe with this, it would just completely disappear. I know I've tried to, in the past, unsubscribe from spam emails and how difficult that can be and the hoops you jump through. So to have an option for parents where they could just say, like, my kid shouldn't be on whatever the app is, and I can just hit one button and they're gone, their account's deleted. That stuff's not going to follow them for the next X number of years of their life, unless someone screenshot it. I think is a really good way to protect kids, especially as they're, like you said, Tony, engaging potentially with adults online that don't have their best interest in it at heart.
Yeah, so we're excited about that, and we're hopeful that this can get through the House. But again, with everything else going on around the globe, this might not take precedent over in the House side. But that is, we'll still continue to push. If you please, and we encourage you to talk to your federal legislators, your congresspersons, especially on the House side to ask that COPPA 2.0 be forwarded on and to be passed so that we can protect kids. I'm sure you all have different examples of kids and their privacy being used in ways that probably shouldn't. So please, we encourage you to call your congresspersons and just educate them. And this is where education, if you educate them on the need for kids' privacy, then you aren't telling them how to vote on COPPA 2.0, so that doesn't cross into lobbying, but you can absolutely talk about it from an education standpoint about the need for kids' online privacy. Also, at the federal level, KOSA, the Kids Online Safety Act, which is House Resolution 6484, was forwarded to the full committee along party lines. Again, Daniel and I met with Congressman Billy Rubin from down in Florida to discuss this bill. He is in favor of it. Um, and so we're hopeful about this as well. The difference between the Democrats and the Republicans both have versions of this bill. The big difference is what is in bullet number three is the preemption, preempting state laws. So this would so if there are state laws on the books now about Kids Online Safety Act, this would have the ability to preempt it. So we don't, we are not necessarily in favor of that. But if we can get this bill, this is where, in the very first webinar we did, we talked a little bit about this being a marathon and not a sprint. So having incremental change is better than no change at all. So, having the ability to have the Kids on Internet and Digital Act, the Kids Online Safety Act, all of these 12 bills that we've been wanting. There are some warts on all of them, some things we don't like, but nothing that is so egregious that we can't work with it and then perhaps do something later on. Our next step would be, okay, how do we take the preemption out? How can we show that, preempting state laws from a federal level not only is probably a violation of states' rights, but then also that, let's let every state do something that protects their citizens as opposed to this huge, overwhelming law that might not meet the needs of everybody in the country. I am a big proponent of states' rights, just personally, and really do think that states, and it's traditionally been that's, a lot of state rights groups have been formed because of the need for states' rights and not let the federal government just be the almost the monarchy for the rest of for the country. So Daniel, didn't know if you had anything to add to that.
Yeah, I just wanted to point out that last bullet point there. There is a Senate version of the bill as well. This is one of those bills where there's a version in both legislative bodies right now that's discussing it. You mentioned that the House version did pass, but along committee lines. The House Democrats are more in favor of the language of the Senate version, which has some bipartisan support on the Senate side. But there's also some criticism that the Senate bill sneaks in some censorship pieces. So, like you said, nothing here is without some warts, but hopefully the fact that there are bills on both sides of the chamber, they'll come to some shared language and be able to get something passed for us.
Excellent. Next slide, please.
All right, this is a bill that again has got some bipartisan support. It's related specifically to maternal health screenings. It's Senate Bill 352, and it is assigned right now in the Senate Finance Committee. And through Senate Bill 352, it would require that perinatal mothers would receive, if they receive a screening in a care setting, that they would have to receive a referral to behavioral health care if they screened at risk or with diagnostic criteria that would show that they have a mental health disorder. And then, as part of this bill, also the Department of Behavioral Health would designate a program or programs that would be available statewide. So, if an area of the state doesn't have healthcare available for that referral, there would be a state agency or a state entity that could receive that referral for them. And we've discussed this. We've got some stakeholders that have reached out to us on this one as well. Um, I think on the surface, we can all support the idea of getting potentially mothers that are at risk for things like postpartum depression, that care that they would need. But some folks have brought up some concerns there as well. Things like would this state referral agency end up inundated with referrals if there are areas of the state that don't have access to care, making sure that they are able to process and follow up on all those folks. There's also some language in there that folks have brought up that say, is this going to lead to a lot of pink slipping or mandated care that may not be necessarily needed because an OBGYN may not have necessarily the training on making those referrals, or a primary care physician. Those kind of folks may not be as comfortable making that referral there. And then also, I know there's an additional one, Tony, an additional concern that people shared, and it's slipping my mind right now.
Yeah, you're the two main ones are the ones that you mentioned, and we don't want. Yeah, obviously, like Daniel said, we're all in for referrals and assessments of folks. As a new mom, sometimes you can be working off of a couple hours sleep. And the OBGYN, again, not trained mental health professionals, could assess them and screen them, and could be more problematic. We want to make sure that that number one, there are enough providers in the state that if someone does get a referral, that they can get help. And then yeah, number two, the big one, which is why we right now are not we're we're somewhere between not supporting the bill and being an interested party simply because of the fear of being, of pink slipping moms. This is something that really does make us nervous, and is something we're actually working with another stakeholder today, and Daniel's going to go over and speak to one of the legislators who sponsors the bill and hopefully get some of that taken out. So this is something that again we're kind of in that we're not in favor of, and we're also not an interested party. We're somewhere in the middle there. But if we could fix some language around the referral process and how that would work and how we would want this to be a more seamless and maybe even some training for some OBGYN folks on how to screen. That would be something that we could definitely support. So this is an interesting bill, and this is where advocacy comes back to understanding and reading what's in the piece of legislation or the rule or whatever else that you might be looking at. That the as they say, the devil's in the details, and this definitely has some details that we aren't happy with, even though we agree with the sentiment of it. So.
Tony, I remember that other concern. It just lists that they would receive a screening. It doesn't indicate that it has to be a validated screening. And so making sure that, especially as we talked about, if that physician isn't trained in mental health, behavioral health, are they going to know, what screenings to use, what's going to be an appropriate tool to ensure that mother or mother to be is actually in need of that care.
Excellent. All right, let's move to the next slide. Um, we're doing, and Daniel, you'll probably take a lot of this because you're the life side guy in our office. But Senate Bill 273 has been assigned to House Public Safety Committee. We provided proponent testimony on March 3rd. Daniel did from his Summit County Chair position. I did from the OSPF side, and we had also the Buckeye Firearms Association, as well as a number of gun owners and gun shops provide written testimony. There's a little bit of an issue with another bill that was introduced, which is a bit like Senate Bill 273. It was introduced in the House, and they had sponsor testimony, and the difference was that in the House version, they would have to a gun shop would have to hand out a pamphlet with it. Now, I'll be honest, I think Senate Bill 273 is the better way to go. Handing out a pamphlet. Here's what my fear is with that is that, and this has been something that has been told to us from, quite frankly, the moment I got to OSPF, was that if you force a gun shop to do something, it could actually add to the stigma. Now, if they're forced to give this pamphlet, the fear is that, oh, by the way, I got to hand you this pamphlet. You can throw it out on the way out. Um, voluntarily, folks can have, with Senate Bill 273, voluntarily, they could be the safe storage facility, but they could also, they could have stuff on their counters if they want, but there wouldn't be that forced component of trying to make someone who is not a trained mental health physician, practitioner, also someone who might not even really understand or care about mental health, force them to hand a pamphlet over and say, oh, by the way, I got to do this, so you can you can throw it away if you want. That's our fear with the other bill in the House. Daniel, do you have anything more to add to that?
No, I think you covered it pretty succinctly. The only other thing that I think about too is one of the beauties of Senate Bill 273 is that I could bring my firearm for any reason. There were no questions asked. And I think by including this mental health pamphlet, again, on the surface sounds like a great resource, but it almost makes it like we're assuming everyone who's bringing in a firearm does have that mental health crisis, and that's why they're bringing it in. And like you said, there's going to be a lot of staff at those gun shops that they're not as comfortable having that conversation around mental health, and so they're going to present it as, I've got to do this. I know you don't want it. It's going to reinforce those stigmas. There is that nice additional, that second bullet point where it did kind of create what happens to a firearm if it never gets picked up, which I think is a component that wasn't necessarily discussed in Senate Bill 273. But I also know that some of our retailers have talked about building a policy internally that would go into their storage agreements. So they were planning on doing that already. But like you said, the pamphlet could be a great tool if it's just there and available and not something that's mandated that the shops have to hand out.
So that's where we are. We're hopeful to get that passed out of the House committee without any amendments. Again, it's support from both the firearms community as well as us and other groups. I know Whitney Strong was at the committee testifying in favor of it. They're a big mental health organization down in Cincinnati, so um, we are hopeful that Senate Bill 273 will be passed as is.
All right, next we've got House Bill 724, which is fairly new. It would require health benefit plans or insurance providers to cover a behavioral health well check, similar to how when we go in for our annual physical health check, there's no charge for that. We don't have to pay a copay or anything like that. So it would allow for that annual behavioral health well check. Certainly, is just someone who's worked around mental and behavioral health for years interested in exactly what would go into that because it's not going to be checking your blood pressure, checking your heart rate, and running some vitals. So, kind of what would be defined as that behavioral health well check as we move forward. Uh, with it, insurance can't require a prior authorization, so you'd be able to schedule that at a BH clinic that your insurance worked with, and you can, just go in like your yearly checkup. And then under most circumstances, there's no cost sharing, which means that you wouldn't have a copay assigned when you went in for that well check. If you've got insurance, you've ever looked at some of the cost for um, behavioral health care, sometimes they can be significantly higher than what your general copay is. So that would be a pretty big cost savings, I think, for a lot of individuals that they were going to take advantage of this if it passes. Tony, thoughts on this one?
Yeah, so I think that this has some again some good points to it. I think from an advocacy standpoint, in local communities, these are great conversation starters with hospitals, primary care physicians, folks like that who uh, to partner with them on trainings or providing you know. QPR or any of those type, Calm or whatever kind of training, and then being able to help them. This is a great opportunity. The government relations folks for the Hospital Association, I'm sure, has this on their radar. I'm sure the Ohio State Medical Association has this on their radar. So being able to um, help local providers, I think would be really, really valuable. And this is it's a great opportunity to reach out and say, hey, we know this is House Bill 724 has been introduced. How can we partner on this so that we can make sure that you have the information that you need, and we're a good partner to you. So it's a good opportunity. This was introduced by, I believe, Representative Andrea White and Representative Jody Salvo. Both they know prevention very, very well. They're probably our two most educated folks on prevention in the House. So um, we will continue to give you updates on that month to month and see how that moves through the process. And then, Daniel, do you want to take this one?
Yeah, got it. So House Bill 718, it doesn't have one of the kind of catchy title names like a lot of the bills do, but it would just revise the Chemical Dependency Professionals Boards, their name and their duties. Under this, it would rename the Chemical Dependency Board to the Behavioral Health Professionals Board. And for those who are aware, the Chemical Dependency Board is the board that oversees prevention certification in the state. So this would directly impact probably a lot of the folks on our call today. It would also expand the scope of what's included with the board. So they would oversee certified peer supporters, qualified mental health assistants, qualified mental health specialists, and qualified mental health practitioners. So again, more individuals would fall under the board's scope. And with prevention being in there and the behavioral health professionals they were already overseeing, um, potentially maybe a delay sometimes in getting things um, certified and getting, that prevention certification process can be slow as it already is. So hopefully that won't kind of bog down the process there. There's also so this bill, because it does kind of change what already exists, was 110 pages long, compared to some of the others like Tony mentioned that are 5 or 6 pages. I did kind of try to dig through as much of it as possible. There were a couple other minor changes. The description for who can be required to be an executive director of a board had a minor language change and things like that. But primarily, it does affect the name of the Chemical Dependency Board itself and then who falls under their scope.
All right, next slide. We had the AI symposium. We had about over 400 folks from across the country, 10 states in attendance. We had both Senator Amy Klobuchar as well as Congressman Don Beyer. Klobuchar is from Minnesota, and and Beyer is from Virginia. They are both heavily involved in AI work, and we partnered with the National Suicide Prevention Advocacy Network as well as SAVE, which is a group up in Minnesota. So we had a really, really great discussion. The Center for Humane Technology was part of this conversation. I know it was recorded, so if you'd like to see the recording of it, I know it is somewhere on our website, I believe. And then we're going to do these quarterly throughout the year. So the next one's going to be June 10th. And we're taking some feedback on what the next set of pieces could be around AI, since it's such a huge issue, and we want to make sure that we also don't get ahead of anybody. Like we don't get so far ahead that we lose everybody because AI is so complex. So this one was more of an introduction from the Center for Humane Technology about what AI is, as well as what is going on at the federal level surrounding AI, because there seems to be bill after bill, both at the state and federal levels. And I know that we have been pretty out front on House Bill 524, which is the that AI chatbots, can't tell people to go to harm themselves or encourage taking their own lives. It is something I just saw in the chat that Emily was kind enough to put the recording of the AI symposium on the in the little chat area. So if you want to see that, it's about 2 hours long. So it is a time commitment, but it is something that we were happy with the first one. We want to get stronger for the second and continue to move the conversation and let folks know, what exactly is going on at the state and federal levels, as well as, exactly what is this AI thing, and that we don't end up with a Terminator or something. So, Stephanie, you are on for a second.
Hey, no, I just wanted to also add that it is also on our advocacy page on ohiospf.org. If you go to take our homepage, will take you to take action. We have a list of some of the legislation that we're following. It also includes the AI symposium as well for the recording link. And also, if you aren't able to scan this QR code that's on your screen, you can also go there and it'll take you out to the link for that June 10th AI webinar. It's at 1 o'clock on that day.
All right.
All right.
Next slide.
Okay.
All right.
Gentlemen, we got 4 more minutes left. And so folks, if you do have any questions, please enter those into the Q&A feature. We do have one. Denise wants to know, she works in prevention, suicide prevention, and she works with a local newspaper to give them updates. How much of this information that we've given today can she share and sharing that information with the community? How about if we were to, again, update that take action page, and or we could certainly, if we wanted to share possibly these slides, what do you think?
Yeah, I think that's phenomenal. And thank you for the question, Denise. Hope you're doing great up in Cleveland. Um, but yeah, we want this to be something that not only prevention providers could use, but treatment providers, folks who are, different parts. It takes all of us. I know that, today meeting with Senator Timken's office on the maternal mental health. We were invited by the Ohio Chamber of Commerce, and that's phenomenal because they've got a platform we don't. And so being able to partner with as many folks as possible on these advocacy pieces, it's pretty hard to do it strictly from one field. So if you get all kinds of support, we absolutely want you to share that.
Okay. I don't see any other questions. Gentlemen, final remarks before we go to the last slide.
I see one from from Evie with the bill
Oh,
on the,
I'm sorry.
yep. There's one in the little chat area. I think only you and I could see. Would the bill on the Chemical Dependency Professionals Board move mental health counselors from the Counseling, Social Work, and Marriage and Family Therapy Board to the new Behavioral Health Professionals Board? It's a great question. I have not a clue. Daniel, do you have anything?
So my thought there would be that wasn't one of the ones specifically listed in the bill language, and a synopsis of the bill hasn't been released yet. So I think Evie, we can fall back up once they've kind of released that. But at least from what I was able to find in the 110 pages, it spoke specifically of those certified peer supporters and qualified mental health assistants, specialists, and health practitioners.
So,
Okay, wonderful. Tony and Daniel, thank you so much again. We appreciate it. We're going to do this again next month, everyone. So the second Tuesday in April is, I believe, if the math is correct, April 14th. If you'd like to scan this QR code, we certainly would love to have you join us. We will also have that. It is, again, on that Take Action page on ohiospf.org. And I will also be sending out some emails to follow up on that as well. So thanks, everyone, for joining us today, and we hope to see you again on April 14th.
thank you.